We've got to do something that's absolutely transformational, because we guess that we could make still some quite effective savings through transactional change, which we're all accustomed to doing things more efficiently, for example, and different configurations of services. But the transformation that's going to be necessary to sustain the NHS over the longer term has to start now. Our tools, I think, are quite fundamental to this. The whole model of the new healthcare commissioning structure helps us for two reasons. First of all, there's still a significant investment that goes from us directly. So we are investing in primary care. We're also investing 12 billion a year in specialist services, trying to ensure that we get the best international quality of outcomes across all the providers. So that provides us with a very strong means of working towards a transformation in the provision of those services. Secondly, and wholly consistent with the model of the reforms, is working with the clinical commissioning group. So £65 billion of our budget goes out to the CCGs. This is a new model in which we don't instruct them what to do, but we work closely with them. And I think we need to help in our work with the CCGs by having a national intellectual, conceptual vision of how the NHS might be more effective over the next 5 to 10 years. But work with the CCGs, and working also through them with their local partners, including critically local government, to explore how that vision can be realised in different local conditions. I mean, one of the critical things which has come recently, and particularly out of Bruce Keogh's review of urgent and emergency care, is a strong clinical convergence about a way ahead, a strong clinical convergence about avoiding unnecessary attendances at A&E and unnecessary admissions to hospital by treating patients in their own homes or closer to their own homes, and doing so in a way which actually achieves two things. One, it clearly is less expensive, but probably more importantly, it's less disorienting to patients and more satisfying to patients to have that revised model of treatment. And so we can see, I think, a number of clear ways in which NHS England, not working on its own, but working in this new model of partnership, can bring about a very significant transformation. If we don't do that, we will not have a sustainable NHS for the future.